Okay, so that's one way COVID-19 has impacted us. Let's crunch down the numbers now of South Africa's cumulative numbers at the moment. We believe that it's risen to 1,574,370 with 1,385 new cases over the last 24 hours. 59 COVID-19 related deaths have been reported, which brings the total number to 54,125 deaths. Dr. Ridhwaan Suliman is senior researcher at the Center for Industrial Scientific Research, and he joins us once again. Apologies for that break in our connection, Dr. Suliman, hoping this time it goes better. So just to recap, you can recap on the average daily cases, but then after that, just take us through the cases per province.
Thanks, Lisa. So nationally, we're seeing a sustained increase in the number of new cases reported over the past week, albeit the rate of increase has slowed this week. We're reporting 1,241 new cases on average per day nationally, and that figure represents a 7% increase week on week. Most of the provinces are stable. However, there are two provinces in particular that are of concern, that being the Northern Cape and the Free State. In the Northern Cape, the number of new cases over the past week continues to increase, and it's increased by 60% compared to a week ago. In other words, new cases are doubling in the Northern Cape every 10 days. The incidence rate in the Northern Cape is at 15 new cases per 100,000 people. So although the absolute numbers are quite small, relative to the size of its population, the outbreak is quite large. At an incidence rate of 15 at the moment, that represents about 64% of the level that it saw at the peak of its second wave, or in other words, the Northern Cape is reporting almost 2/3 as many cases as it did at the peak of its second wave in January. The Free State is the other province of concern. The number of new cases in that province has increased by 23% compared to a week ago, and the incidence rate in the Free State has crept up to 8 new cases per 100,000 people in that province, and that incidence rate is at 41% of the value that it saw at the peak back in January.
Yeah.
All of the other provinces are relatively stable and either flatlining or showing slight decreases compared to a week ago.
And I do apologize that we keep preempting you by showing up the wrong graphs, Dr. Suliman. So let's just see if we can hopefully get up the correct one now. So you were talking about the daily figures and we're looking at provincially. So now let's look at the average daily coronavirus tests per week in South Africa.
Sure. So the number of new tests being conducted across the country has increased as well this past week, and the increase in testing has kept up with the rate of increase in the number of infections. So the number of infections, as you put up in this graph here, has increased by 7%, as mentioned earlier, but the number of tests being conducted have also increased by 7%. Over the last week, we're conducting just almost 29,000 tests per day across the country.
Okay, so now let's talk about test positivity, average daily test positivity rates per week in South Africa, and what are they telling us thus far?
So the test positivity rate has been stable this past week at the same value compared to a week ago. And that's in line with the rate of increase in testing as well as the rate of increase in infection. So just to recap, the test positivity is the proportion of positive tests to total tests conducted. So while total tests have increased by 7%, the number of positive tests or cases that we are detecting have also increased by 7%, resulting in the test positivity rate remaining at 4.3% this week, at the same level that it was last week. So while this value is below 5%, which is good, so that's a national value, I think it masks the fact that there are certain provinces that are of concern. And I think there are 4 particular provinces where the test positivity rate needs to be looked into and corrected.
Okay. Now, the test positivity rates per province, tell us a little bit more about that, especially people are, or the provinces at least, are performing differently when it comes to how quickly they're able to test.
Sure. So if you look at the test positivity rate per province, you'll see 2 particular groups in the different provinces. So the 4 big provinces, that being Gauteng, KwaZulu-Natal, Eastern Cape and Western Cape, as well as Limpopo, are maintaining test positivity rates below 5%, which is good. And that's driving the national test positivity rate figure to below 5% as well. But however, there are 4 other provinces where the test positivity rate is ticking upwards, and those are of concern. In the Northern Cape, the test positivity is close to 15%. In the Free State, it's also increasing, as well as in the Northwest. In those 2 provinces, the test positivity rates are above 10%. And also in Mpumalanga, the test positivity rate is nearing 10%. So all those provinces, the test positivity rates are of concern.
I want to look at this one, Dr. Suliman, the hospitalization rate, especially admissions per week in South Africa. Now, also, while you talk us through that, if you can just explain to us, if you've had COVID-19, whether hospitalized or not, does it guarantee that you won't end up in hospital?
No, so let's look at the hospital admissions first. As you can see from the graph here, last week we saw a slight increase in new hospital admissions, and again this past week that increase has continued. So nationally, there are just under 1,800 new hospital admissions across the country, and that's an increase of 9% week on week. The increase is driven by increases in those problematic provinces, a 30% increase in Free State, 28% increase in Northern Cape, and a 10% increase in the Northwest. Now, if you have been infected with COVID-19, to go back to your question, generally we're seeing that approximately 15 to 20% of confirmed cases do require hospitalization, unfortunately. And that can be seen by the trends that we look at in hospital admissions compared to confirmed reported cases. Also, previous COVID-19 cases, perhaps in the first wave or even in the second wave, we don't know how long immunity lasts. And so because of waning immunity, one could possibly be susceptible to reinfection again. Okay.
So while we have that in mind, the average daily COVID-19 deaths per week in South Africa, tell us what are they telling us? And you can also talk to us provincially. And if some of that could be as a result of what is known as long COVID, as in the long-term effects of COVID-19 infection.
Sure. So nationally, the number of new reported deaths across the country has decreased slightly compared to a week ago. We're reporting an average of 59 new deaths per day, and that's a decrease of 9% week on week. So the decrease is good. However, I still believe that the number of deaths that we are reporting remains higher than that expected, given that there's a certain proportion of confirmed cases that are expected, unfortunately, to succumb to the virus. The level that's higher than expected is due to a number of provinces that are still undergoing data verification of that. So there's still a backlog of reporting in the number of deaths. Long COVID certainly is an issue, and it affects thousands of people still. And the long COVID essentially is where people continue to experience symptoms of COVID-19 for weeks or even months after getting infected. So that remains a concern. We don't know how long this may last, and we don't know exactly what the numbers of people who are still suffering from long COVID. But it's certainly a problem, and it's not reflected, though, in the recovery numbers, which essentially just show those that are no longer infectious.
So, Dr. Suliman, if you could just explain this to us, the technical terms of what you mentioned. There's excess deaths, but there's the fact that we also count amongst the deaths the immediate viral infection, those numbers. So what is the difference? So when you say the numbers that we're seeing are high, what does that mean, in contrast to those who are saying that the numbers are only a tip of the iceberg?
Sure. So all of the figures and the graphs that are shown here are based on the reported figures. And the number of deaths that are reported here are those directly related to COVID-19 deaths. What we also need to bear in mind that not all deaths are picked up or reported as such. And so an important measure to track as well is the excess deaths, which essentially looks at the number of deaths due to natural causes across the country and compares to expected levels based on historical trends over the previous 2 years. So essentially we're looking at the number of additional deaths across the country. And the excess death figures takes into or includes the number of COVID-19 reported deaths, but also those that go unreported. And generally we're seeing that the excess death figure is about 3 times as many as the reported COVID-19 death figure. Although all of that excess cannot be contributed to COVID-19, estimates are that at least 50% and up to 90% of that excess is related to COVID-19, unfortunately.
Well, thank you always for your time and taking the time to speak to us and take us through the latest trends. Dr. Ridhwaan Suliman is Senior Researcher at the Center for Industrial and Scientific Research. And of course, some of the long-term effects or impacts of COVID-19 include coagulation disorders such as blood clots. And believe it or not, some of it includes metabolic or endocrine carcinomas. There's gastrointestinal, mental health, cardiovascular, which of course the nervous system, and some of it also includes skin disorders, the kidney and the general malaise, fatigue and anemia counted amongst those as well. Now,